Hello, my name is Kenyatta Williams, and today we're going to discuss the topic, Johnson & Johnson. Yes, Johnson & Johnson. What comes to mind when we say those two words? Baby products, baby lotion, baby powder, and baby shampoo. But did you know that Johnson & Johnson is an American multinational enterprise founded in 1886, one of the most comprehensive health care businesses in the world, in the entire world. Now that's not all. They also have a commitment to saving and improving lives. Saving and improving lives. How so? By raising healthy communities, identifying and addressing unmet needs, and advancing in healthcare leadership. They will be able to provide scholarships for nursing education. Research has shown that by strengthening the healthcare workforce, Johnson & Johnson will be able to help make childbirth safer for mothers and children by eliminating mother-to-child transmission of HIV. They will also be able to help by preventing chronic diseases and educating communities. How you would say, how would they educate a community? One way to educate a community is by having a support group. A support group will get out and show awareness. Maybe by having a fundraiser, maybe by posting up flyers, maybe by having a televised interview. But they will introduce the statistics. They will talk about prevention. They will talk about detection, and they will talk about treatment. In a support group, they also can have private meetings where ones come together to discuss their illnesses, to ask questions, to have an interchange of encouragement, and also to discuss the next step in healthcare. So let's go back. When we first spoke, we spoke about saving and improving lives, which is big. But how would they do this in the entire world? We're not talking cities or states. We're talking about the entire world. Well, of course, one of the main sources would be the World Wide Web or the television. Those are two. So, having press conferences or interviews talking about the statistics, maybe you could get this information from the health department on what's widely spread and what needs to be discussed as far as HIV and AIDS. Then we have chronic kidney disease, and one of the biggest thing is cancer, all types of cancer. So early detection may save someone's life, but they have to be educated on it. Let's go back. We talked about providing scholarships for nursing education, which is huge, because you have to be educated in order to be able to teach. To be able to teach and to be able to treat. So you have to know what you're doing. Johnson & Johnson will continue to work to save and improve the lives of millions of people in ways as strengthening the healthcare workforce, saving and improving lives of women and children, and preventing diseases in preventable populations. Let's talk a little bit about that. Vulnerable populations, which could be Africa, Mexico, overseas, China, or right here in the United States. Yes, we're talking right here in the United States. It's some vulnerable populations, and it's some individuals out here that need to be educated on how to prevent and how to treat when diseases come on the rise. That goes back to raising healthy communities. See, this is a big topic, raising a healthy community, because you can't do anything about something that you don't know about. And it's not going to happen overnight. It's going to take time, a lot of time, because some people are in denial. They don't want to know, or they can't deal with the fact after they know, which could send them into depression, which is a mental illness, or contemplating suicide, or the feeling of just hopelessness or loneliness. All that plays a part if you have a chronic disease or just a disease, period. But by educating the community, they will know what's on the rise, how to protect themselves, how to discuss the matter with family members, and how to get treatment if they've not already gotten treatment. And treatment is not always available to everyone due to insurance purposes, because insurance is very costly. But we do have a health department in every state which offer free immunizations, and we do have hospitals that would accept you if you have the state insurance, and then some that do work have insurance for their job, so they pay almost sometimes 70 to 80% of the cost. So it's good to try to prevent the disease before you have the disease. Let's just say one of the most common disease is the flu. The flu is a disease. It's a common disease. If you get the flu immunization, it helps set the body up, so if you was to get the flu, it can fight the flu. Okay, so you just prevented a disease. Because say if you didn't get immunized and you got the disease and your body didn't know how to fight it off, you can really get sick. It can affect your other organs, and you can possibly lose your life. But by being educated on it and being able to prevent it, you saved yourself. And then what did you do? You told your friend or your family member what happened, and then guess what? They saved themselves. And guess what they did? They told the next person. Now guess what all 3 or maybe 4 of you have done? You have exchanged words of encouragement to one another and preventing how to get the flu. See, it's that simple. That's called a support group. You supported one another by sharing information that helps you to prevent a disease. You got it. And that's what Johnson & Johnson is doing. They're helping, saving lives, and improving the health of people. People in general. Not just women and children, but people over the entire world. The entire world. It's as easy as 1, 2, 3. If you tell someone, and someone tells someone, and someone tells someone, and someone tells someone, now we're on a roll. And you can just imagine how it keeps going. And that person tells the next person, and that person tells the next person. And now it's worldwide spread, and prevention is on the loose. And then the next city or country, they see what you're doing, and then they want to host. And then that's how educating the community comes along. Johnson & Johnson will continue to work to save and improve lives of millions of people. And if you would like to learn more, go to jnj.com. Thank you.